Okay, so in this first column, the first thing that we're going to discuss is infection prevention. We're going to start with hand hygiene. The first section says that you understand when you should use the alcohol-based hand sanitizer or when you should use good old soap and water. So with that, you never want to use the alcohol-based hand sanitizer if your hands are visibly dirty. If you've been out working in the garden, it's not time to use the alcohol sanitizer. You want to use good old soap and water. If you've just eaten lunch, you want to make sure you use soap and water. If you've gone to the bathroom or used any kind of facilities, you want to make sure you use soap and water. So those are times where you definitely always want to use soap and water. Any other time you can use the alcohol-based hand sanitizer. Next, it's going to go over how do you actually use those two things. So with washing your hands, you want to make sure that you get soap. You rub the soap with wet hands together for 15 to 30 seconds. It's usually a good general rule of thumb to make sure that you sing the ABCs twice, or Twinkle Twinkle Little Star, something like that, and you make sure that you've scrubbed every surface of your hands. After you finish washing your hands, you're going to rinse your hands. You're going to get a paper towel. Usually there's some sort of paper towel holder that doesn't require you to touch anything. Usually you wave your hand in front of it, the paper towel comes out. Take the paper towel, dry your hands off, then you're going to use that paper towel to then turn off the faucets. You can even use it to open the door. The point is you're trying to minimize any contact with your hands in any restroom facilities to any surfaces. Alcohol-based hand sanitizer is a little different. You're going to get a couple pumps of the hand sanitizer. You'll have that gobbledygook on your hands. You're going to rub your hands. If you just did this and then you reached out to shake somebody's hands, that's not going to work. It hasn't done its job. You want to make sure that you rub the alcohol-based hand sanitizer and on all surfaces of your hands, front and back. Don't forget your thumbs, and make sure you've rubbed it until it completely evaporates and your hands are completely dry. That is the effective way to use the hand rub. The third thing under infection prevention is proper use of gloves. You want to make sure that you change your gloves in between each use. So don't think that you're protecting yourself or protecting patients by putting on a pair of gloves when you get to work and leaving those gloves on all day. In fact, you're doing more damage, or you're running more of a risk at spreading germs by doing that. So if you wear gloves, if you're in a situation that requires you to wear gloves, and an example of that would be to clean a wheelchair, you're wearing gloves. If you use the gloves to clean a wheelchair, we want you to then take the gloves off and throw them away. We don't have to conserve. We're not worried about conservation of gloves here at Tanner. We want to make sure that we use enough to keep our patients and you safe.